Hi, Lisa Donner here from Liberty Nation, and with me today is Gabriella Fiorino. She has written a very exciting and interesting article on a possible heroin vaccine. Gabby, can you give us the backstory on this?
Yes, so the Scripps Research Institute recently produced the first ever successful heroin vaccine. It could end the physical dependence characteristic of heroin addiction. The vaccine just passed animal trials, and researchers are planning on moving on human trials. This has big implications not only for those struggling with heroin addiction, but for society as a whole, as opioid addiction has recently become an epidemic and caused the HIV and hepatitis C outbreak.
Let me
Um,
ask you this, Gabby. I don't remember, has there ever been another vaccine for an addiction before?
well, there have been some in the making, but you're correct that one hasn't been put on the market. There are some in trial for nicotine and the opiate fentanyl, but there hasn't been one approved by the FDA.
So essentially, could you tell us how would this work on an addict?
So vaccines treating addiction generally work by preventing the drug from reaching reward centers in the brain. When a patient takes heroin, opiates bind to various opiate receptors, but the one involved in the strong feelings of addiction is the mu receptor. So when a heroin molecule binds to the mu receptor, they cause a release in dopamine, which causes those characteristic feelings of dependence and euphoria. So what the vaccine would do is it mimics the chemical structure of heroin and causes an immune response. The body would learn to treat heroin as a foreign body and as a dangerous virus and block it from binding to an opiate receptor and causing the characteristic high. What's interesting about the heroin vaccine is that it only works for heroin. It doesn't work for other opiates. So patients would still be able to take opiate painkillers for surgery, etc.
Gabby, how long do you think this will take to study on humans?
Um, Once clinical trials are approved, the drug testing has to pass 3 phases on human subjects. So each phase takes about 2 to 3 years to complete.
So the chances are this won't be on the market for heroin addicts for 6 years. Is that right?
Yeah, so it'll take about 7 to 8 years until we potentially see it on the market.
All right. Thank you very much, Gabriella Fiorino, here on LibertyNation.com. I'm Lisa Donner, and this is LNTV.